Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today it is my very, very great pleasure to welcome Roqeebat Bolarinwa out of Nigeria. Roqeebat is a registered nurse. She also serves as the national chairperson of the Standing Committee on Research, Nursing Education and Academic Development at the Nigerian University's Nursing Students Association, and as the organizing secretary at the University Scholars Forum. It says her passion for research led her to seek further learning opportunities and making her a cohort of the Institute of Nursing Research in Nigeria, a member of the Youth Health Action Network, and a member of the African Forum for Research and Education in Health. Her research interests include non-communicable diseases, vaccine technology, vaccine uptake and advocacy, malaria, and global health determinants. She is recognized as a future nurse scholar. And she also runs the RN Pathway program, helping nursing students stay organized and prepare effectively for exams. So, welcome, Roqeebat.
Thank you so much, Dale.
Thank you for doing this. Thank you for doing this. It seems like you have done quite a bit. But tell me, what led you to nursing? What made you become a nurse?
Thank you for the question. At the beginning of my nursing career, I don't have a career yet, let's be specific. But I mean, at the beginning of my nursing journey to study as an undergraduate, I saw it as a way of giving back to my community. But what inspired me the most was my auntie. She's a nurse, and our first daughter is also a nurse. I grew up seeing them being respected by members of our family and held in high esteem. And they were so empathetic and full of so much love to share around. And I wanted to be that person too. But on getting to my final year of high school, I saw that it was more than just wanting to be loved and wanting to be empathetic and caring for people. I knew I had to be passionate. I took my time to read up on nursing, the challenges, what to expect. And then I said, I'm in for this. Let's do this.
Okay, so you read about the challenges and what to expect. So what were the challenges for you?
You have a social life, and then your time will be taken by a lot of activities. If you are not in class, you'll be on clinical postings, or you are doing research, or you literally don't have time to party. You can't hang out with friends like other people in other departments would. But then I thought I'm not much of a social person, and maybe this would be a good escape to always not want to attend events. But that's changing now because I'm more social than I used to be in my first year. And as regards the challenges, I believe I could fight my way through. And it seems I'm doing just that now.
Okay, okay. It seems to me that you're doing that very well. As I read your resume, you've done quite a bit of stuff. So what would you say? I realized that on your resume, it says that you're in your final year. It says you're a registered nurse in your final year as nursing student. How does that work?
In Nigeria, the registered nurse program is the council exam legislated by the Nursing and Midwifery Council of Nigeria. So it's what you need to practice as a nurse in Nigeria. And now there are two ways to study nursing in Nigeria, either through the diploma, which is the School of Nursing, that's for 3 years, and at the end, you'll be getting your RN, the diploma RN certificate. But for my program, which is the Bachelor's in Nursing degree, I am in the university, so I'm an undergraduate student automatically. But I also need to take that RN exam, which will certify me as a registered nurse that can be licensed to practice. So I have gotten the exam. I wrote the exam, I passed, and I am now a registered nurse. But I still need to get my degree, which explains why I'm in my final year, but I'm still a registered nurse.
Understood, understood. Got it, got it. So I know that as part of the program, you have, you have clinical practice and stuff like that. And right now, as a new nurse, as a new RN, and still in your year studying, probably you haven't had a whole lot of clinical experience. But of the experience that you've had, what attracts you the most?
The experience I've had so far, the area of nursing that attracts me the most is pediatrics. But that doesn't mean it's an interest I would love to explore.
Mm-hmm.
I just love the empathy that comes with caring for these babies and children. The fact that they can't express themselves, they just cry, and you don't even know why they are crying, but you try
Mm-hmm.
everything possible to be of help to them. And when they are fine, the smile they give you, even though you can't understand their language, well, it's a way of making you feel fulfilled as a nurse that you tried your best to care for this baby, and now he or she is fine. But
Mm-hmm.
I have other interest in oncology because it breaks my heart, and it explains my interest for vaccinology towards preventing cervical cancer, cancer in general.
Mm-hmm.
But so far, I don't think I would want to be in the clinicals, at least till this moment of this interview. But
Mm-hmm.
there is no aspect of nursing that doesn't interest me. But the best one so far is pediatrics, like I've ever said.
Mm-hmm. Mm-hmm. I so you just mentioned that you're interested in vaccine technology, vaccine uptake, and that kind of thing, vaccinology. So is that something that is widely accepted and made use of where you are?
Do you mean worldwide?
No, where you are in Nigeria.
Yes, vaccines. Yes, they are
Okay,
widely
is widely accepted.
right.
Okay, excellent, excellent. You have a particular interest in research. Why research? What drew you to that?
What drew me to research was my background in writing. I've always been a writer since I was a child. And coming into the university, I saw that I could communicate to make people feel better beyond healing with my hands, which is the
Yes.
core nursing concept. And then
Mm-hmm.
I was writing to motivate people, writing, sharing my growth journey, and explaining how they could be better than they were before. And my writings begin to have impact even in countries I've never been and people I've never met. And somehow in 2022, there was a nationwide strike, which meant we didn't have to go to classes because our university and their regulatory bodies had issue. So it affected the students automatically. And then there was a training in our school, the NONSA, that is our association. They had an online training on research, and I attended. After my attendance, I saw that this interested me because I'm a very curious person. I always want to know more. And to discover that there was this aspect of nursing that could just answer my questions if I was passionate enough to search, I reached out to the speaker. His name is Nurse Oluwadareniola. And then I told him I am interested and I want to explore this beyond this your 1 hour presentation. So he recommended that I join the next cohort of the Institute of Nursing Research. I had you read that when you were introducing me. So I joined, and somehow I started meeting these nursing scholars and the impactful work they were doing, reading papers. I just felt like I have found a path, and it's a fulfilling one.
Well, that is such I feel excited for you as you're telling me about it because right away, almost at the beginning of your career journey, you have found a niche that actually excites you and brings about all your passion and all of that. It takes some of us a little while to find the thing that grabs us. So it's awesome that you have found it at this time in your career, at this time in your journey. That's awesome. That's awesome. I love it. And so you talked about always wanting to write, always writing since you were a child. And I see that you have a newsletter.
Yes, I do.
Okay. So that's where that came about. What do you think, though? Again, I know that this is probably born more out of observation rather than experience, but I'm going to ask you this question anyway. Um, what do you think you'd like to see change about nursing in where you are?
Mhm. Two things. The first one is the hierarchy should be positive and not parasitic. The fact that as a nursing leader, you had something difficult doesn't mean your juniors should also have it difficult. The roles of superiors is to clear the path for their younger ones so that they can find it easy to walk through. You don't always have to make things hard for your juniors again just because you found it hard. And the second one is nursing students and nurses should embrace innovation. The world is going digital, and that's no news. And if we don't want to be left behind, because they say artificial intelligence and technology cannot replace nurses, definitely. But there are some core things that nurses need to know as regards innovation and digital health in general. And if you have all the clinical experience in the world, you know the textbooks from cover to cover, but you can't get digitalized education properly, you'll be left behind because there are people who will replace you and they will do very well at it. So we should embrace continuous knowledge and we should not be left behind.
And so you bring up the role of technology in healthcare and in nursing in particular. First of all, um, a question I want to know is how much of technology is incorporated into educating nursing students in Nigeria and into the delivery of healthcare.
At the moment, if compared to global standards, it is optimal, I must
Mm,
be honest. But exams are now computer based, including the practical exam. So it's something that is coming into reality. And as for the case of simulation based trainings, a number of schools are already employing them into teaching their students. And I believe it's a gradual process and somehow it will circulate.
yeah,
But personal development is key on our part. We should also do our best to take online courses, attend trainings, workshops, and so on to integrate what we were taught in class and know the technological aspect of it. So we won't just be left behind and we can always compete with global nursing talents as well.
absolutely, absolutely. My thing is that I see technology, and I'm going to say encroaching, although that may not be the word, encroaching very quickly or being assimilated very quickly in education and practice and things like that. And you're correct, we're going to have to keep up. You're going to have to keep up. So you well, what advice then? You're still a student, you're an R and you're still a student. What advice do you think you have for prospective nursing students?
Prospective nursing students,
Mm-hmm.
please do not give up on your dreams. Beyond the fulfillment that comes with nursing, there are going to be hard days. You will feel tired, and the only thing that will hold you back is the passion. Of course, we all seek fulfillment beyond I am passionate. I'm talking about the financial fulfillment now because it
Yes.
is necessary for living the life of our dreams. But you must be genuinely passionate because you come across some cases, you won't be able to eat, you lose your appetite, you might get home and you're just so sad because you probably lost a patient or something bad happened at work. But you still have to brace up and not transfer aggression to your family and also get up and go to work the next day. And you also have to study. So it's going to be a roller coaster of emotions. And as much as possible, have somebody who can always listen to you and someone you can always share things with, such that during your downs, it can always bring you up. But nursing is going to be fulfilling and rewarding. I wish you the best.
Yes, 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 indeed. Yes, indeed. And you talked about the emotional roller coaster. Um, I think that my personal thing is that we don't talk about that enough. I don't think we adequately prepare nurses for the emotional toll that it can take. So, what do you do though? You talked about being in school, and when I asked you what the challenges were, you talked about not having a social life and how much of your time it takes up. So, in all of this thing that consumes you, what do you do to take care of you?
I sleep.
You know?
Yes, sleep cures a lot. For
Okay.
example, last
Okay.
night I was feeling burnt out from all the work I did during the week, and I have the daily goal to study what was taught in class. But somehow I just wasn't in the mood. I knew I should study and I knew I had things to get done, but I didn't have the energy. So I thought instead of waste this time, why not sleep earlier and then wake up in the midnight to revise? And that's what I do most times at night when I'm feeling tired and I have a number of things to do. So time management is very, very important. It's not enough to say you want to manage your time because there are impromptu nursing departments, impromptu classes, impromptu come and get this done, and you almost can't control your time. But that's not an excuse to not plan. And talking about planning, it also involves planning for my study. You mentioned the RM pathway, helping students plan. It's
Yes.
part of what I do to help other students too in preparation for their professional exam. Because having so much to get done can make you feel overwhelmed to the point that you don't even know where to start, you don't know what to do. But having a structured daily routine of what to study part time, why not compromising on your other activities, classes, postings, and so on? So, planning and managing my time well is one way I tend to relax, but most of the time I sleep. It works magic for me.
Okay, okay. And that's another thing that is huge because at this stage, at this early stage, you have recognized what you need to take care of you. And that is something that I think a lot of us go through for a long time without actually identifying what specifically takes care of us individually. So that's awesome. That's awesome.
Thank you.
I have one more question. If you could tell me what you see as the most essential quality of a nurse in just one word, what would that word be?
Empathy.
Empathy. Why empathy?
It encompasses all of the roles we carry. As a nurse, you are a carer, you are a surrogate mother, an advocate, a mother, and a teacher, and so much more. And in everything that we do, the central theme is empathy because you have to be empathetic to be able to put yourself in the patient's shoe. That doesn't translate to sympathy anyway. You don't have to
Mhm,
cry more than the bereaved because as a nurse, you have to be able to control your emotions, but you
mhm.
must also be empathetic towards them and try to see things from their point of view towards giving them the optimal care they desire at that point in time.
Awesome, awesome, awesome. I know I said that that was the last question, but I actually have one more, or maybe it's even two. Where do you see Roqeebat in 10 years?
That's a great question. 10
Hmm.
years, 2034,
Hmm.
in so many research journals contributing to the scholarly aspect of nursing and
Hmm.
ensuring that it is translated into practice because it's not just enough to conduct research for the shelf and for the journals. And also leading public health offices across the globe while advocating for the preventive aspect of nursing because I am not a pro pharmacological kind of nurse. Before
Mm-hmm.
I would transcend the path of drugs or something, I ask questions. Do you sleep well enough? Do you think your diet is adequate? You're telling me you have an headache and you spent 12 hours on your phone and you haven't eaten today. I won't just recommend now go take acetaminophen or something. So that aspect of nursing interests me a lot, and it's something I always, even within my immediate surrounding, I tell people you don't have to take drugs for everything. You don't even have to self-medicate. Ask yourself questions. What are you not doing right? What should you do more and do less of? So I believe in 10 years, I would even my voice will even be louder and it would have impacted people, communities globally. Yes, and many more, but that's just the central theme.
You can go on and on. I believe that too, because I'm looking at what you have done and you know, you're at the beginning of your path. And so I believe that also. Yes. Congratulations
Thank
on
you.
that big vision.
Thank you
And
so much.
I love the fact that you think globally. Because many of us tend to think locally, and there's nothing wrong with local. I mean, everything starts locally.
Right.
But at the same time, we do live in a global society. And so we have to think globally, and I love the fact that you do that.
Absolutely. Thank you.
Before we go, is there any last words you'd like to leave us with?
Yes, one. And it's a sort of encouragement for your viewers as regards picking their passion and doing what interests them. Nursing should be the foundation for even greater things you should achieve as a person. It shouldn't stop you. It's going to be hard to want to combine a lot of things alongside your nursing career, but you thank yourself for it, especially if you are still a student. You can't come back to make up for the times you have probably not used well enough. So, as much as possible, support that cause, volunteer, go for the outreach. If it's to learn a new skill, and if it will mean doing less of some other things that don't contribute, just like watching TikTok, just binge scrolling Instagram without anything to show for it. Just be very detailed and intentional about everything that you are doing. And I pray nothing is kind to you and that nothing is the sky is your um is this starting points they do say so
Yes.
yes you
Yes.
can make progress and you do very well. I'm rooting for you.
I'm rooting for you, Roqeebat. Thank you so much for this.
Thank you too.